Thank you very much for inviting me. I will start with words which Dr. Werner told, that physicians and physicists very often fight. And in order to avoid this fight, being a physicist and get PhD in laser physics, I decided not to fight, to go to medical school, get medical degree, and become the surgical oncologist. And then all fights eliminate. Then it was fights with the business. But it's very interesting that all my invention came from the major physics. It started as a surgical oncologist. I started treating the uterine cervix cancer using the laser. And one laser for the diagnostics in situ, and then use another laser for removal in situ the cancerous cells. And it's turned out lasers were so huge, big, and when I use it, I noticed that sometimes I hit hairs and hairs disappeared. And thanks to Arnold Beckman and George Schultz, who was vice president of Bechtel Corporation, they invited me in '88 to come as a professor of Arnold Beckman and Bechtel to UCI. And I started using, of course, all research and all clinical work on the uterine cervix. And it's turned out that it was more interest in the hair removal than uterine cervix. And my friend, who was at that time vice president of Thermo Fisher, before it was Thermo Electron Corporation in Boston. And they invited me to talk, but their defense industry company, it was the developed lasers for defense for US. But my friend talked to CEO of the company, and CEO, okay, I will meet this crazy guy, but let's listen to him. And I told him that you could use lasers to remove hair and so on. I filed a patent for this. He told, okay, it's not much interest. Next morning, he called me that my wife didn't let me sleep. You have to go for hair removal. I'm Greek and I need hair removal. And this how the Thermoelectron acquired this idea, this patent. And it's turned out in 1993, from the idea we went for 1.6 billion market capitalization for hair removal. We use neodymium first to put cream to remove stratum corneum and then radiate with neodymium the rest of the follicle. And when I was in Boston, director of Wellman Lab, it was Dr. Parrish. And we had the conversation. He told, not much interest, but I have another crazy scientist. He's from MIT bachelor degree, but he's a pediatric dermatologist. And the first time I met Rox, at this time it was '89. It was interesting that at that time, the whole hair removal started launching. And we launched, I don't know, people know or not know, we have FDA approval in '93. And 3 years later, we had a lot of companies jump in. It was another company from Boston, Palomar. They created laser which eliminate pigment from hairs, but it was too huge device and not very much effective to stem cells located at the papilla, and they changed their strategy. But its Nd:YAG is still it's probably one of the lasers which keep using for hair removal. What happens? I didn't bring my other glasses. I have to be very, very close. This is the picture of first hair removal laser. And what happens in 1993, and we have 95 approval, and we were several years, and then we sold to every company that it's allowed to use for hair removal for the hair removal purposes. At the same time, when I use NDR, when I use CO2 to remove uterine cervix, the cells, I use for diagnostics another military laser, which was developed in Russia first and several years in America. It's 1500. It's very eye-safe laser, very good one, and it's very light. I brought even with me to UCI. And it's turned out that 1500 laser was brought to several people, but then it was what I don't like. The fight for the patents. Attorneys make a lot of money from this, but finally it was federal court decided that it's my patent was first, but when they told this is a first, next year I decided to give it to everyone, and with SEC commission I wrote a letter, and they allowed to use that everybody could use 1500 for whatever purposes they want in the beauty and dermatology clinics. The first 1500 laser was created here. Half of my PhD I did here in Paris, and I came back to my friend who did PhD at this time at École Polytechnique, and we created first 1500 laser over here in France and sold it all over the world, including United States. And 1500, as you know, the most popular laser as of today in the use. Then 1500, which I brought with me, it has only 1 millimeter spot size and pulse by pulse. I decided to put scanner, and this is how the first fractional laser were created. I was awarded 4 patents for fractional technology. It was 2000, 2001, and it was a created company Reliant. We invited again Rox Anderson and Dieter Marstein to reduce it to practice, and they are brilliant people. Especially, I could tell Rox did a great job to introduce it, reduce from the science to the clinic. In 2007, we launched it to the market, and we were fractional laser at the market until 2013, and then finally I was told by my colleague, dermatological Mohs surgeons, that for 13 years of fight against melanoma for my beautiful wife, she doesn't have any longer melanoma. And again, I wrote a letter to SEC, and anybody could practice fractional technology from 2013. And it was a big award for me, what happens. Unfortunately, later on, she developed another cancer and passed away, but it was the reason why it happens. Then, being an oncologist, I always was, my passion was to return back to oncology and try to work. How happens a little bit with my wife, I find out that if you take stem cells from the cancer and then let these stem cells proliferate, and when they proliferate, they deliver not only initial tumor, they have antigens of all lines. And these all lines, for example, for melanoma, 11 lines, and when she had the melanoma 1 type, when you proliferate stem cells, cancer stem cells, you will have 11 lines, and you have 11 types of antigen. And metastatic disease It's almost changing from metastatic one nodule to another nodule. And when you inject it, you have attack. You don't know your immune which line attack, but it's a very effective way to treat. And I returned back to stem cells research and stem cell clinical trial, and we took bone marrow, and you could, from one bone marrow we bought from government, you could make 1 million treatment doses. And with this treatment for human bone marrow-derived exosomes, cytokines, 150 cytokines, we identify for FDA 38 of them and make a topical product. And it's turned out not only injectable, but topical products work very well when you use laser 1927, 1940 for open skin, and it's very good. We still in the clinical trials to use fractional laser and stem cells for, I'm living in San Diego last 40 years, and we have a lot of sailors, and they develop a lot of the photoagent, a lot of sun damages, and we find out that you inject bone marrow-derived stem cells and then radiate with the laser problematic area, and chemokines coming from the area where you radiate, they go systemically to the place and start delivering in this area all anti-inflammatory proteins on vascular neovascularization created en route. It works excellent, but it's turned out we have only 15% sailors and 85% of sailors' wives, because they want for the participated the rejuvenation. It works well. And when we created Frax Cell, I want, first of all, of course, big respect to Rox and Dieter. Then I brought it to Europe, and I want to say thank you for Dr. Gandolfi, who was always pioneer in all new lasers, and we brought it here. At this time he was president of Italian Society of Plastic Surgeons. He used it, and very nice gentleman, and he did a great job. But what was attracted to me that he is a very interesting person. First of all, he started surgery at 5:30 until 6:15. I asked, why 6:15? Because 7:30 opera, I am a singer, and I have to go back to the opera to sing this, the opera. And the second one, what I remember, when the first time I met him, asked him, where are you from? Are you local from Como? He told, no, I'm not from Como. In 1601, our family moved from Florence to Como. He is not local. He is a very interesting person. Recently, I discovered one of the patents issued 10 years ago in 2015, and I just read some papers, two companies using this technology. It's where you focus some beams that it's allow you to cross-section of the beams to go deep, go up, and very much effective regulation. And I'm very happy that inventions still are implemented. A little bit about binary effect. As a physicist, I was always amazed why to break stones with very high ultrasound doesn't work until you have a binary machine. When you bind together 2 beams, 3 beams, then it's destroyed. And I didn't understand the reason of this destruction. It's turned out it's very simple, like why the weapon couldn't go through the metal very easy, couldn't go at all. When you combine 2 together, why it goes in. And it's turned out that at the surface they create cloud of the double energy, triple energy, and they pushing the beam together with shock wave much deeper. And we have discovered if you combine, create binary laser system, it creates superficial cloud with shock wave propagation of other wavelengths, different wavelengths, 3 times deeper than itself. For example, 300 microns, 250, 300 microns, 1500 goes. If you combine together with 1927 and send it back, it creates cloud around 200 micron deep, and it pushes 1500 up to 1.5 millimeter, and where this wavelength's never been before. And it's creating a lot of clinical outcomes. And it's about patents, but why I'm showing this patent, it was very interesting. When scientists, to develop something new, I think I did a very interesting, exciting job. In 1990, 1991, I developed laser, which you put finger under the light, press a button, it creates a hole and blood coming out. It was excellent. And I was surprised in 2 weeks when patent was issued, I had a call from the biggest in the world, I don't want to name them, but the biggest in the world needle manufacturer. They told, we want it. I told, excellent. I signed the agreement of the licensing, but I didn't read well. I didn't have very good attorneys. I have now in family my attorney, Dr. Philip Tankovich, and I didn't put in the condition of the agreement that they have to develop, otherwise I get it back. And during the patent length, 20 years, they pay me royalty, minimum money royalty, but never develop because they get much more money from the disposable needles. That's always watch, not only patent attorney, but it's patent license attorney, an attorney who could help you. That's to be in the business. And thank you very much. And it's my long, short story. Thank you.